And since we're talking about solutions, here is one coming in from Haryana, where a public-private partnership has come about as far as looking for solutions. We have with us right now Mr. Devinder Singh, Additional Chief Secretary of the Government of Haryana. Thank you very much, Mr. Singh. And Puneet Ranjan is the Global CEO of Deloitte. Thank you very much. My first question to you, Puneet. You've partnered with the Haryana government on a project. Would you like to tell us a little more about it?
Deloitte is doing multiple things. First, we have 50,000 professionals in India, and our obligation is to protect and support them. And we're doing everything we possibly can to do that. Second, we have partnered with 40 other US multinationals, and we are providing assistance like oxygen concentrators and ventilators. But third, which I'm very excited about, is the partnership that we have with the government of Haryana, as well as with PHFI, which is the Public Health Foundation of India, and PGIMS, which is the premier medical institute in Rohtak, to provide assistance in an integrated way to hard-to-reach communities. And what we have done is we have launched a pilot program in Karnal district. And that program is focused on creating a command and control center, leveraging telemedicine, virtual health, and we've done some very creative things there. We'll talk about that. And also leveraging things that are unique to India, like the Anganwadi and the Asha workers, as well as an education and awareness program, a 3-tiered medical hospital structure to try and get medical assistance around COVID to hard-to-reach communities all over the district of Karnal. And our hope is, and it's been done in record time working with the government of Haryana, it's been a great collaboration. As Devinder likes to say, a public-private collaboration with purpose. It's been delivered in 3 weeks. And our intent is to try and replicate it in other districts and hopefully statewide.
Okay. Mr. Singh, how exactly is this partnership going to help the government in the future? You know, this public-private model.
Precisely this model in which both of us had alignment of thoughts in terms of strengthening the supervised home care system. Because we realized that when the second wave was at its surge, at its peak, then about 6% of the COVID positive cases were in tertiary healthcare and 94% were essentially in their homes. So we wanted to strengthen and make it more robust, the supervised home care system, in a manner so that it becomes a replicable, scalable and sustainable model, which not only takes care of the second wave, and then of potentially third wave and even beyond. So to that extent, I think it was a highly successful collaborative venture. And I think Puneet came forward from Deloitte instantly, because I think on 10th May, we made a presentation and he says, what you are saying is like music to my ears, because we really want to strengthen the supervised home care system, because that is where the bulk of the patients are. And they were anxious, they were uncertain, panic-stricken, fear-stricken, and thinking whether they'll get a bed or not. The tertiary care system was overwhelmed because everything was like 3x.
Yeah.
If you compare the first wave and second wave, it was 3x. So therefore, it was important that apart from strengthening the tertiary healthcare system, where there was pressure on ICU beds and oxygen, we wanted to strengthen the supervised home care model. And that is what Deloitte also wanted. So therefore, we clicked from the word go. It was a great collaboration, both teams together. You know, from 10th May we started, and 24th May it was inaugurated by Honorable CM. So you cannot imagine 14 days flat, we were able to implement the model. And it cost about 5 crore rupees. So there was procurement of material, equipment, services, as Puneet mentioned, and all of that happened in a very ethical procurement mechanism, and everything done with due diligence.
But you know, Mr. Singh,
it is easily scalable. Yeah.
Okay, it's easily scalable. Interesting. But you know, Mr. Singh, you used an important word where you said that we need to reduce the load on the health infrastructure. Now, one of the ways to reduce that load on healthcare will be vaccinating fast. What are your plans subject to availability of the vaccine, and how soon can you vaccinate the population?
I think very relevant. apart from this strengthening the systems, for the vaccination, we have our PHCs, CHCs, and we have vaccination centers, both in the urban areas and the rural areas. And we have our, mechanism by which through the COVID protocol where anybody books for a slot, so they can be vaccinated. And apart from that, there is a walk-in facility also available now in various government offices where 15 to 20% of people walking in can also be vaccinated. So there is enough space and bandwidth created, not only in district Karnal, throughout state of Haryana, where we are ready with the supply issue sorted out, as you rightly said, to very quickly vaccinate, because we have capacity to, for example, in Karnal alone, we will be able to vaccinate at least 20,000 minimum per day. I mean, that is the minimum capacity we have. So therefore, just to give you an example, we have a population of 15 lakhs. So if you are wanting to cover, let's say about 60% of the population, which means about 9 lakhs people. And if you are doing every day 25,000, so you are talking about covering the entire population within a maximum period of 2 to 2.5 months. So we have that.
But that's just one area. Mr. Singh, that's just one area. What about the rest of the state?
So similar metrics, in fact, applies to the whole state. Practically, the infrastructure which I'm talking about, that can, ipso facto be taken for the entire state also, which means the capacity to be able to vaccinate the entire eligible population can take no more than maybe maximum 3 months when the supply is available.
Okay. Mr. Puneet, how can your partnership help here?
Command and control center that has been set up for Sanjeevani can be replicated to monitor vaccinations. The education and awareness program, which is part of the integrated program, can be used to try leveraging the ASHA workers, can be used to increase knowledge around vaccination, why it is important, where is it available, etc. So the program that we've implemented in Karnal can be repurposed and replicated for vaccination as well.
This model, as I said, it is not only for tackling second, third wave, for all the community health initiatives, including vaccination. This is a model which is fit for purpose, as Puneet described. So we'll be able to leverage this for vaccination as well.
Okay, very interesting. Good luck to you, and let's hope that we can look at these solutions fast and vaccinate fast, because that seems to be something which is going to save us from this virus. Hopefully, there will be, as many people are saying, a third wave is inevitable. We have to be prepared, which is why, like a mantra, everybody keeps saying, vaccinate, vaccinate, vaccinate. Good night and goodbye.